Okay, we got it. Okay, thank you for being back. We are going to get started with our Highland Highlights weekly recap, and I want to introduce you to a couple friends. Last week we talked about colic and specifically addressing stress. And a lot of times there are things that we can do within chiropractic, and other times there's nothing that we can do to continue to progress the baby. So we're going to be talking about what we can do to help colic and different issues that kind of tie into the physical stress that baby might be experiencing, and also tongue ties. And if you've heard anything about tongue ties, you'll probably recognize that it's happening more and more, and we're going to address why that is. And so I have Dr. Zinke with Zinke Dental and Melanie Henstrom with Baby Bonds to help us go through that. I'm going to slide off the screen because they are who you want to be able to see today. But I'm excited that you guys are here. So if you have any questions, just let us know. You can put a comment in YouTube, on Facebook, on Instagram, and we'll be able to ask that directly to them or to the group. So without further ado, I do want to have you guys, I'm going to shift off here because we only have so much room that's on YouTube or on Instagram. But we want to start off, and really I'm going to allow them to introduce themselves as far as like who they are, why they're here, and why they decided to really focus and be experts in the field that they're in currently. I mean, when it comes down to it, we want to be able to make sure that we have experts that we work with, and trusting experts with their expertise. Pediatricians and even chiropractors, we don't know a whole lot about tongue ties, and that is why I have them here. And so, Dr. Zinke, I'm going to have you introduce yourself and tell us a little bit about why you are where you are right now.
Yeah, hi, I'm Sam Zinke, and I am a general dentist, but I practiced general dentistry for many years before I learned about tongue tie. It's not something I learned about in dental school, but it wasn't until my third son was born and had some difficulties gaining weight. He had a tongue tie release, and it helped him so much. He just bounced back and got right back on track with his weight. And then looking back on my older two sons, we realized they had all the classic signs and symptoms of tongue tie.
So it was like personal experience, and that's one of the things, like for me in my profession, it's like that changed everything. When you see it happen to a family member, it's like, yep, if that can change my family's life, then it can change everybody else's family. Yeah,
and then that took me down a rabbit hole of advanced education and shadowing and learning, and it was really rewarding.
Yeah, and you've been in Boise for how long?
Well, I grew up around here, but went away for 12 years, including dental school, and then I've been here since 2018.
Okay.
Back home again.
Back home.
Yeah.
Good to be home.
Yeah.
And then Melanie, I've known Melanie for years now, and tell us a little bit about yourself. And yeah.
So I'm a mom of 6. I have twins. All of my children are older now. My youngest, I only have one left at home who's 17. I got into lactation about 7 years ago, and I felt compelled to learn more about helping moms and babies breastfeeding. I had been a postpartum doula for several years before that, and found that a lot of moms were struggling with breastfeeding. And so I decided to learn more about lactation. And surprisingly, even as a lactation consultant, you don't get much time on tongue tie training. I had to seek that out by going to conferences, and luckily I also was mentored by amazing mentors who also were tongue tie savvy, and that's where I got my education and training.
Interesting. Now, if you guys haven't heard about tongue ties, or you're wondering like what the heck is a tongue tie, we're going to dive into that. We're going to talk about what a tongue tie is and what it might present as. Obviously, with anything, there are situations where you might think that there's a tongue tie, or you might think that there's not a tongue tie, but there is, and that's why always having that evaluated by a professional. I actually had somebody call in earlier, and they had asked a couple questions to the front desk, and they're like, hey, do you think this is going to be helped with chiropractic? And I said, definitely, maybe. Like, there's so much more to look at. And so the first question that we typically hear about, and this is for you guys, is what is a tongue tie, right? Like, what is the actual, what I call a nerd term? What is the nerd term for that?
One that comes to mind is ankylosing.
Ankylosing. So if you hear that from your pediatrician and they don't refer you to them, then look them up, and they're here to help you. So tell me what it is that a tongue tie actually is. I do have some pictures so that I can put that up to show everybody, but what is a tongue tie?
Yeah, a tongue tie, well, there can actually be a number of oral restrictions or tethered oral tissues in the oral cavity of a child, or any age for that matter. But it's tissue that's there for development when the child's in utero and growing. It's supposed to go away, but in some cases it fails to go away and causes a restriction in the range of motion, and that can cause functional issues.
Okay.
Yeah. So the best way I like to tell people, and I don't know if the pictures are actually showing right now or
Not yet.
Okay.
In just a little bit.
I tell people that there are obvious ties, and some ties are not obvious, but to go on symptoms. So everyone's born with a frenulum. Just because you have one, though, doesn't mean you're tied. But if it's to the tip of the tongue or right behind the tip of the tongue, that is a tie with or without symptoms. But some of our babies have what are called submucosal ties or normal-looking frenulums, but they have a lot of symptoms, and so that tells us that that frenulum is still causing restriction in baby's inability to do that full peristalsis motion of the tongue to do effective removal of milk from the breast.
So what is the frenulum?
The frenulum is the tissue under the tongue that basically is normal anatomy if it's in the right place and has enough length. And it just goes from the tip, the tongue under into the base of the mouth.
It's like that line of skin that just like lines right down the middle. So I'm going to pull up a couple pictures just to show you guys. This would be considered more of an obvious tongue tie potential. Now, this is an example where it's not as obvious. People kind of consider that a tongue tie is when you can see the frenulum go to the tip of the tongue. That's how I looked at it. But is this always going to be a tongue tie?
This would be, absolutely. Okay. That is very restrictive, obviously. That baby can't lateralize very well. They can't extend very well.
Okay. And in this case, the one that we have up here right now, it'll come back. But the one that you don't really see the frenulum connecting, talk to me about that. Like, how is a parent to know, like, oh, we should get them checked out for a tongue tie?
So really it's about symptoms, and when you see that cupping of that tongue specifically, you know that there's tethered tissue in the middle. We call that a posterior tie.
Okay. So these are presentations, guys, if you're watching this, these are presentations that I feel like, I mean, is it safe to say that if their baby has any sort of presentation like this, that they need to be evaluated? Absolutely. Is that safe? Okay. We're going to kind of switch over and say, okay, well, what happens if we don't have these addressed? I mean, it kind of brings up the question, Dr. Zinke, do adults have tongue ties?
Yeah, I treat many adults that have the symptoms from untreated tongue tie. And in the adult case, it can be a lot of TMJ, sleep apnea, muscle tension, neck and back pain that's related to the compensations from dealing with this tight oral tissue.
And Melanie had a direct experience with a tongue tie release as an adult.
Correct. So my tongue tie actually was it was not obvious at all. In fact, everyone I went to told me I wasn't tied, even people that were supposedly trained in posterior ties. But I had all the symptoms, almost all the symptoms of adult tongue tie. I had migraines, I had acid reflux, I had scoliosis, I had tight neck and back, food intolerances. I was miserable all the time. And so I found a provider, Dr. Gahiri in Portland, who was willing to do the release, and it has been life-changing for me. My scoliosis is almost completely gone. I don't get migraines anymore. I don't need acid reducers at all anymore. I even had precancerous Barrett's disease in my esophagus and was scoped for that 2 years ago, and it's gone now. So it has been life-changing for me.
And for those of you who don't know, Barrett's esophagus is basically when there's so much reflux, there's so much acid that goes in the esophagus that it almost it causes calluses or just irritations, and super uncomfortable. Yes. So that alone is life-changing. So both of these providers have had huge changes within their personal and family lives just from being able to address this. And that's what's really cool is having people who have direct experience with what they do. So why are we seeing so many tongue ties? And this is years ago when I first met Melanie, I was like, okay, cool, like tongue tie is great, but why are we seeing so many? Is it because we're looking for them now, or why? What is the reason that we're seeing more and more?
Accurate.
Okay. Yeah. No, I think awareness is a big reason. Even my own personal experience. My oldest son's 11, and we didn't have information. We didn't have a clue. We weren't in an area where there was good education and knowledge about it. And then when my youngest son was born, we were in Oregon, so we're kind of closer to areas where people had heard about it. Mm-hmm. So I think awareness is a big key. But then maybe Melanie can speak to, I think traditionally breastfeeding saw like a fall off and then a resurgence. So I think I heard some number like many more moms are attempting to breastfeed than mm-hmm. did historically. So the numbers of breastfeeding babies and people wanting to make that work is way up.
Right. I think, yeah, for sure, as we have learned how important breast milk is, moms, almost all moms want to at least attempt to try to breastfeed, and some so badly that they're willing to do anything to have that happen. And so I think because of that, we are definitely seeing more cases of it, but truthfully, we know that there's been tongue tie for as far back as we can look.
Sure. And so it's not necessarily just that we're looking for it more, it's that there was kind of a fallout from breastfeeding, and now it's really picking back up again because the importance is coming more to light, and so then we're tying that in. And that's the other thing is, like, when it comes to nursing, I mean, I know that when moms are, say, in a hospital, they have the opportunity to have somebody come in and help them with latching, right? If baby's not latching, they can come in and help. But if they continue to have issues, that's a reason why they should probably go to you and see, is it a tongue tie? Because I'm sure that you've seen people or babies that, they're like, I think there might be a tongue tie, and you're like, there's not one here, but we need to change something. Is that correct? Or is it like everybody has a tongue tie that goes your way?
So I would say a good portion. I just had one yesterday that I don't think's tied actually, but most people that are coming to see me as a private lactation consultant are having either breastfeeding problems or really fussy, colicky baby.
Yeah.
And so I would say that the majority of my practice is tongue-tied babies because they've made it so far that they are willing to privately pay someone to try to get some help. And because that's what I specialize in. Yeah. So people that have sought out and see the symptoms of a tie and learn about it, and they go on and start asking, who do I go see, then my name comes up. And so I think that that's the main reason why I am seeing so many tied babies, whereas I'm certain that not every baby is tied.
Sure.
I do feel like when I go and assess babies, we find either lingual weakness, or we see a high palate, or we see inability to pass the suck test, or we see gassiness. Some of these babies are super colicky, and when we take care of that air swallowing, which is called aerophagia, then these colic and reflux symptoms go away almost always when they can swallow appropriately at the breast and manage that suck, swallow, breathe pattern better.
So you said a few things in there that I feel like might be helpful if you can break it down. Like, we talked about looking at the tongue and seeing the frenulum tied to the front of the tongue, and then also the cupping shape of that tongue where that baby was crying. What are some other presentations or things, like you said, you mentioned the palate. What are some things that maybe parents can like feel into baby's mouth? Like, is there anything that they can do just to like if they're like, I don't want to go get evaluated if it's just going to be like I pay for an evaluation, it's like, hey, everything's good. But what are some things that they might be able to look at or look for besides colic symptoms, digestive stuff? Like, is there something else?
Absolutely.
Yeah, it is mainly, I would say, it's more based on symptoms and appearance. So even looking at the high palate or looking at the tongue appearance, you could get led astray. So you want to look at symptoms. I mean, we have a list of baby symptoms and mother symptoms. And one that actually came to mind that you don't want to go by is, one of the symptoms is poor weight gain. And that's one, though, that just because the baby's gaining doesn't mean they don't have an issue. There's just a lot of times compensations, the baby or the mom is making compensations, there's extra stress, and many times the baby's gaining fine, but they have all these other symptoms like poor latch and the colic and the reflux. One that's big in my mind is short sleep episodes where they're requiring feedings every 2 to 3 hours. And then there's a lot of mother symptoms. I'll let Melanie talk about some of the mother symptoms.
Okay.
Yeah, so we'll see painful latch, nipple damage. Sometimes moms will have to do a lot of breast compressions to get baby to even get enough food. We'll see postpartum depression due to poor sleep. I've had some moms, I had one mom even last month that told me that her baby fed 17 times in one night.
Oh.
That's a huge indicator something's wrong. That one probably wins the prize of most feeds in one night. But I've had many moms that are waking up every 45 minutes to an hour, even with babies that are older. And that is a huge disruptor of family stability, right? If you have a mom that's not getting sleep, then things just really spiral. So then we see the anxiety and the depression and all of those things.
Yeah, it just adds up on top of each other. And when you go without sleep, I mean, everything is magnified. The stresses, the little things that set you off. Pain increases because the body's inflamed and it has not basically like reset or healed. That's significant. So if you are dealing with a baby that has short sleep episodes, you need to have them checked. You need to have them evaluated. And that's actually, it's interesting that you say that, because this morning we had a mom that was like, she's just can't sleep. She's not sleeping. And I think they had just, I don't know if they have an appointment with you or if they just barely did. Regardless, I'll check and get them into you. But so those are some things that you guys can look at just within your own families or friends' kids. I mean, be a help to somebody else and help them get where they need to be. Now, the question is, and I know that I've heard a couple things about nutrition relating to tongue ties. Can you dive into folic acid and folate? That has been like kind of a hot topic, especially with the MTHFR gene mutation within the past couple years. And so can you talk about that nutritionally, of like what might be helpful for mom while she's pregnant? Not that it's like, if you do this, then you won't have any tongue tie, but like nutritionally, can we talk on that?
Yeah, so I always encourage moms to do the folate over the folic acid, just because there is such a large population that has the MTHFR genetic mutation, and those individuals cannot methylate the folic acid into the usable form. However, interestingly enough, we don't really have enough information to know if that's really the cause. And Dr. Gahary just did a Facebook post, I think, a couple weeks ago about that, saying that, you know, that's what we're blaming it on, but we don't really know, truthfully. I mean, is it that we've just, you know, have too many toxins, or is it that we've genetically mutated, or what is it? Or is it the folic acid? We don't know. But regardless, we don't want to not take our folate because we don't want to increase the chance of spina bifida. So it is a midline, it is laying down more midline tissue. So that's the theory, is that we're doing that also in the mouth, and it's just not atrophying enough away, causing that tethered oral tissue.
Yeah. And so I was going to say, I've seen, I was looking just yesterday, and everything that I was reading was like, it's not conclusive, but is it going to hurt you, right? Yeah, and so making sure nutritionally that you have a good supplement, that you have those components, so that in the end, it's like you're doing as much as you can. So I want to go into a couple examples of what a tongue tie revision looks like. Let me bring this up here. And I've heard a conversation, Dr. Zinke, you could speak to this, is we talk about what a proper revision looks like as far as the presentation underneath the tongue, where we're looking for a diamond shape, right? If it's a circular shape, or if there's not even any sort of like puncture within the mucosal tissue, then that's not done correctly. And the next question to kind of tie on that is it possible to do a tongue tie revision and then have it reattach?
Gotcha. So yeah, it's actually pretty common. I think if you just Google ankylosing or you look at tongue ties, there'll be descriptions of that the proper way to do tongue tie release is just sort of a bloodless clip or a snip, and that can happen commonly with some providers where they'll want to be as minimally invasive as possible, but in doing so, then you don't really get a full functional release. And so, like you were saying, the diamond shape is really critical, where we go. It's really not much farther to go. It's not like we're cutting deep at all, and in my case I use a laser, but you have to find this endpoint where the mucosa divides into this diamond shape, and then you know you've got a good functional release. And there's also beyond the mucosa, there's fascia. That's a big thing about tongue ties. It's connected to fascia that runs throughout the body, and there's also fibers of fascia where we make sure the fascia is released as well. I think in a lot of cases where there could be reattachment, which is really healing that recreates the original adhesion or loss of the range of motion. It's like you could release it, you would restore range of motion, and then the healing, if it's not guided in the proper direction, which I think we'll get to later, doing proper stretches and wound care, then you can see a reattachment of the tongue back down to the floor of the mouth. But I think in some of these cases, if there's not a full functional release, there's not really a risk of reattachment because there never was a release to begin with. Okay,
that makes sense. And so I'm going to show you guys what a release looks like. And so right up here on the screen, you can see that, I mean, I'm assuming that that's a good example of a proper release. Yep. Okay. They approve it, so we're gonna let it be. But you can kind of see that shape, that diamond shape, right there in the middle. And it's not just like, hey, do the tongue tie revision and then you're done. You really need to continue and do stretches. And are there exercises as well? Or
so suck training, we encourage parents to be doing infant massage, rhythmic movements, which I teach them at their first visit. And of course, we encourage all of our parents to see a chiropractor and a PT / craniosacral therapist. We just get much better results when we're working on, releasing tension, making new muscle memory, helping babe to do things the right way.
Yeah, that's great. So I'm going to show you guys. Did you have anything else on that?
No, I just will emphasize again that the frenectomy, as much as I think it's great to do it and have it done properly, it really takes a team. And like I said, the IBCLC, the chiropractor, to make sure that you get really good outcomes. Yeah.
And that's why, I mean, a lot of our younger kids or little babies have seen Melanie, and Dr. Zinke has done the release. And like you mentioned, you do the laser. Like, let's jump to that really quick, and then I'll show this video. But why the laser, and what are the other methods, and why is yours the best?
Well, I do think that you can have a proper release with either scissors or a laser. I just personally like the laser because it has a very large margin of safety. If you think of like a ballpoint pen, the laser only really works right at the tip. It's a very small area where it's going to affect the tissues, and then there's a foot pedal. So if this baby is moving a little bit, you can move the tip of the laser, or you can let off the foot pedal, or both. And I just felt like, I've never personally used scissors. I've seen it done, like I said, I've seen it done well, but I just think of what if the baby's going to move at that point where you're about to make the snip.
You're like, oh, no, I'm doing it.
And the laser cauterizes, it cuts, it kills viruses and bacteria. So there's just a lot of advantages to it. I'm really comfortable with it, and I do think, for me, for my kids, that's what I would want. So that's why I use it.
Yeah, exactly. Whatever you do for your kids, do that to others. You bet. So the next video that I'm going to show is, let me see, a suck training video. And there's some audio playing, so we're just gonna let that audio play. This is a happy boy.
He is.
So it's just about done, but I want you to kind of explain.
Yeah, so right now I'm just massaging in the cheeks. A lot of times our babies are hypertonic through there from compensating. And so, is the video still playing? So they won't hear me.
There we go. Yeah. So what was happening? You were squeezing on the cheeks. You were tapping the tongue. What was going on there?
So when we touch at the front of the mouth, the baby will extend the tongue, or at least we're hoping that they will. We can trace the gum line to get the tongue to lateralize. We can push on the sides of the tongue to work on strengthening the tongue. We also do what's called just basically a tug-of-war suck training, where we're just basically doing this very small circular motion, getting that tongue to kind of strengthen and come forward. And then we do the cheek massage, because a lot of our tied babies are hypertonic through the cheeks, and they've been compensating when the tongue's not working correctly. They will use their cheeks and their jaw to try to get the milk. And so the massage just helps to release that tension.
Interesting. Yeah, pinching on the cheeks. I mean, if they're tight, and do you feel it actually kind of release a little bit? Okay.
So yeah, and I'm just kind of doing this little massage through here, and if it's really tight, sometimes they'll really get worked up about it. So then we try to do it when they're sleeping, or we do it a little lighter, or we do it just from the outside. They tend to tolerate it better from the outside only. Some of these really tight babies until we can get in there deeper.
So this is one of the things that you can try to do this on your own, and you can like have little bits of this information of like massage and push their tongue around, but in the end it's way easier and you get far faster results. Number one, actually getting the tie released, but then also having them kind of help manage the care from there. So now the next video that I'm going to show, these are aftercare stretches. And so we're going to be able to hear you through the video, but if you want to explain kind of what's going on.
Okay, so we're going to do aftercare stretches. I'm going to come a little bit closer so you can see a little bit within the mouth if you can.
Okay.
We're going to lift the lip all the way to the nose and rub in the site. We're going to scoop under the tongue and pull the tongue back towards the throat so we can see that diamond. And then we're going to rub in the site and we're out. Good girl. Good girl. All right, go ahead and stop.
So that's an example of aftercare stretches. I mean, super simple, right? And when people talk about tongue tie revisions, they might be scared of like, it's a super invasive, super intense surgery, or it's not, and it really is. And especially when you're dealing with professionals that have done this time and time again, you can feel confident knowing that, hey, this is going to be the best thing for my baby. Now, we had a comment from Lizzie on Instagram. She said, I suspect when kids were babies, but was always dismissed. So like she suspected it for her kids. Is it worthwhile to have older children or yourself as an adult evaluated and corrected if one is found? And that's actually a good question, because that's where I was going to go next. Of like, we've talked about revisions for babies because that is like the best time to do the revision, right? They're not really fighting you like a toddler, or for an adult you can talk about that, but we know that tongue ties can help babies. But let's shift and talk about, I know we gave an experience for you, but what does that look like? At what age is it okay to like, hey, let's check and see if there's a tongue tie there, and what that might look like, and why an adult or a kid might want to be evaluated beyond just a couple weeks old or a couple months old.
Yeah, like you were saying, it's really good to do as early as possible, just so there's not compensations, and it's much easier to manage the stretches and the aftercare. And then functional breastfeeding really acts as the therapy that's needed to integrate the tongue to function properly. It does get much more difficult after like a year old, and so when I have people call and the kid's 2 or 3 or 5 years old, it depends on the risk and benefit. If there's sleep apnea, if there's severe speech issues, if there's things going on, then sometimes we'll see if we can get them in with an ENT that can do the procedure under sedation. So there kind of becomes this no man's land, at least in my practice, between like age 1 and I would say maybe like age 10. It depends on the kid. I've done a few younger, like between 6 and 10, but a lot of that comes down to, can they do the proper myofunctional therapy to have good outcome after the release? And so you just have to look at a case-by-case basis. For a child, it's still good to get them evaluated. There's things you can do like orofacial analogy, or also known as myofunctional therapy, or speech therapy, body work, and kind of plan when would be the best time to intervene. And then with adults, it's more looking at their airway and their mouth and their TMJ and seeing in what order of operations should you release the tongue. Because there's usually by that time a lot of problems that maybe the tongue tie release is important, but it also needs to be supported by, say, having their jaw joints and their teeth, their bite be in the proper place.
Interesting. And do you have anything to add on to that?
Yeah, I mean, usually, often when I'm educating parents about their baby, parents will say, well, what about this with my so-and-so age child? And so as they learn, they realize, oh my gosh, this is really important. And I tell parents they're really in that hard, like Dr. Zinke said, that no man's land, 1 to 8, 9, or 10. We have to ask ourselves the question, how severe is the tie? Is it causing the child to be apneic or severe behavioral issues, or are they choking on their food to the point that it's life-threatening? So those would be reasons to consider a release. And the reason why it's hard at that age is because we can't do a release on them without putting them under anesthesia. So we have to say, okay, is it worth the risk of the anesthesia to, to whatever symptom they have? So usually with speech alone, we say no. With, I guess, what would some of the other ones be that would be a no? Probably not headaches or anything like that. It would be something that would be life-threatening, and that would be a reason to consider anesthesia.
Got it.
So, and they can stitch it too with older children and adults, and so then you're not as worried about that reattachment, although you still need to do stretches and exercises. So it is good to have a child that is willing to be able to do those.
Okay, got it. So I hope that answered the question. I'll see if there's any other questions specifically. Can it lead to issues with development of the teeth and the bite?
Yeah, absolutely. The tongue is really nature's palatal expander, and I've also heard that your lips are your face's braces. So the teeth sort of develop in this neutral zone between the forces of the tongue and the forces of the lips and the cheek muscles. So the tongue is in large part responsible for proper jaw development, and then whether there's room for the teeth within those jaws, which in turn determines the size and function of your airway. So it's huge. It's really everything in terms of orofacial development, and then good health, being able to breathe and sleep properly.
Interesting. The lips are the, what did you say?
Your lips are your face's braces.
Lips are your face's braces. I've never heard that. Okay. Well, I remember when I did a Zoom call with Dr. Zinke a couple months back, and I was just asking him some questions, and then he was able to evaluate just from our Zoom call. He was like, okay, you've got this and this going on with your bite, and I'm like, I thought that I was perfect. He's like, if you want to address this later, you can. But it's one of those things. What I really appreciate about both of these providers is that they will always do the best thing for the individual, for the patient. They're not looking to just, everybody's a tongue tie and everybody needs, this specific work on the dental side in order to expand the palate or this, that, or the other. They will always take into account what the individual wants and also what they need. And so that for me is huge, because I don't like referring to people and just having it be like, okay, hey, it's going to be $80,000 and you're going to do this, this, and this. I like to have people who are down to earth, providers that are down to earth that I work with directly. And so if people want to get in touch with you, I'll link below the video, like for YouTube and Facebook, I can throw in your website. But for people who want to get in touch with you, what's the best way to get in touch with you?
Yeah, I've got two, zinkedental.com, that's more for adults, and then I have idahotonguetie.com for infants. Okay,
so Zinke Dental, Z-I-N-K, zinkedental.com, and then idahotonguetie.com. Okay, and then for you?
And I'm just babybonds.us, so babybonds.us.
Babybonds.us. If you guys have any questions specifically, or you wanted to reach out to us before you scheduled something, we're happy to help. So you can direct message us, give our office a call, whatever you feel like you need to do, then do it. We're here to help you, as are they. So do you have any last things that you want to share, or that you're like, I need to say this? Is there any last words?
So my thought that I had was, really, it's not just about breastfeeding. This is about the individual baby's entire life. So if you have a baby that's tied, a lot of people think, well, I'll just pump and bottle feed, or I'll just do formula. And that is an option. But if you understand the magnitude of how important it is to have a functional tongue, the more that I learn about that and how it affects your whole entire development of your mid-face and your airway and your gut health and on and on and on, it is so, so important that we do not ignore these.
Yeah, you made me think of, if you think about it, there's nothing more important than your next breath.
Yeah.
So ultimately for me, this affects breathing, which is really about life and quality of life. So that's what I like helping with.
I love it. Well, Matt, for me, I kind of feel like if you have the choice right now to at least have your baby evaluated, that one simple decision, and I use this as an example for babies that we see in our office, just for like, hey, I just want to see how they're doing post labor and delivery. That one thing can drastically change the trajectory of that child's health. Just that one simple decision. And so I'd invite you guys to, again, check out Zinke Dental, babybonds.us if you have questions. Again, reach out to us. Otherwise, we will sign off and look forward to seeing you guys next week. Thanks.